So this abstract is been commissioned on behalf of the International Kidney Cancer Coalition. I'm the chair of the board for this particular organization. It's a global organization. We are an umbrella organization that serves 60 patient organizations around the world. And we, every 2 years, do a patient survey. And this time around, we surveyed 2,700 patients and caregivers, and we asked them 46 questions. And we do this in 16 languages. And one of the things that we focused on is emotional health of patients. And what we did see is that 85% of patients living with renal cell carcinoma have some type of emotional concerns. And these would include things like depression and anxiety. And close to 50% of patients will express some level of anxiety and fear of dying. It's clearly a really major unmet need in the management of these individuals. And so one of the other things that we looked at was whether or not patients were able to talk with their caregivers about this. And about 50% or so across all of these countries were able to talk to their caregivers, but close to a third of them didn't find that those conversations were particularly helpful, which is kind of interesting as well. And then it's sort of asking which resources did the patients find most helpful. They did find that patient organizations, online resources were helpful, and also support groups. And the things that they really wanted would be to have more support groups, more counseling, and more information on how to really sort of manage the situation. The patients clearly do not feel that this is really being addressed to the same degree that they would want, with around 50% of them saying that they've been able to discuss this with their care teams. And I think that integrating some sort of psychosocial health algorithms into our care plans would be really valuable for our patients.